Hey, what's going on, guys? Dan from Fitness Pain Free. I am a physical therapist. I'm here to help coaches and clinicians troubleshoot pain and injury with their patients and clients in the gym. Today we're going over some modifications and troubleshooting for pain in the shoulder during bench press, okay? In the last video we went over modifying load, and today we're going to talk about changing the grip that you're using for the bench press, okay? So what I recommend first, if you have a patient that has shoulder pain in the bench press, the first thing you should try to do is modify the load. Okay, so that could be slowing the repetitions down, maybe that's increasing the reps. If that's not effective and the patient is still not able to bench press in a way that feels tolerable or pain that's less than a 3 or 4 out of 10, the next step that I usually do is try to change the grip, okay? So imagine I'm bench pressing with a bit of a wider grip. If I go more narrow, a couple things happen. For one, you change the elbow position. So you see that my elbow gets a little bit closer to my side, okay? And what that does, it probably changes some of the stress within the shoulder, right? And the other piece is that as I take my grip closer and closer, I'm probably increasing the contribution of my tricep and decreasing the contribution of the shoulder. So if you take someone that has shoulder pain, you go wide to narrow, oftentimes you can really decrease the pain, okay? The other thing you can attempt to try, and this is something I'd try after you tried a bunch of other things because it's kind of a weird movement, but you can go from an overhand grip here, right? So pronated, and think about where my elbows are here in this movement, and I can go to an underhand grip, okay? Now if you notice what occurs from this grip here to this grip here is I really change the angle at my shoulder, okay? So we do have some research that shows if I change my grip from here to here, I will change the structure that's in my subacromial space that may be getting compressed, okay? So when I bench press, one of the most common injuries you can have is some sort of injury, some sort of injury or irritation to the rotator cuff or the biceps tendon, okay? So if I go from here to here, I change which structure is being stressed, okay? So if I've overused this position, if I go here, I might end up feeling a little bit better as a result, okay? So if you have a patient that has shoulder pain in the gym, first thing to try is modify the load. If that doesn't work, the next step would be to change the bench press modification. So going from, let's say, a wide grip to a more narrow grip, and you could potentially try to use an underhand grip as well, okay? A narrow grip is probably decreasing some of the stress in the shoulder and increasing some of the tricep utilage, right? So we're now putting a little less stress in the shoulder, a little bit more work for the tricep and the elbow. And if you use an underhand grip, we're probably changing the stress in the shoulder, potentially by moving the stress away from the rotator cuff and onto the biceps tendon or vice versa. Okay? So guys, the learning is not over. If you're a coach or you're a clinician and you want to continue leveling up your game as a physical therapist or a coach, here's another video. I want you to take a look and I'll see you on the next one, all right? Thanks a lot, guys.